Hi, buddy. Dr. Daniel. And today I'm talking about how long does a migraine last? Most persons are not acquainted with the International Classification of Headaches Disorder, ICHD version 3, the universal reference for specific medical information about all headaches. For many persons, it's difficult to differentiate a plain old headache from a migraine. They just don't know the specifics. ICHD is clear about how long a single individual migraine headache can last, and that time is 4 to 72 hours. The only type of migraine headache that can be confused with a single episode of migraine occurs with chronic migraine, where the individual may have continuous headache at the migraine top for days, weeks, months, and sometimes years at a time. Chronic migraine is usually due to medication overuse syndrome, a headache problem caused by taking too much headache medicine. How long does the migraine last? By definition, the International Classification of Headache Disorders, a single attack of migraine headache may last 4 to 72 hours. This reference of time to limiting an episode of headache is helpful in differentiating migraine from other types of headaches. The migraine process causes the release of 3 inflammatory neurochemicals, neurokinin A, substance P, and calcitonin gene-related peptide, abbreviated CGRP. CGRP is produced in both peripheral and central neurons. CGRP is an active vasodilator and functions to transmit nociception, which means pain, in the cerebral trigeminal vascular system. The cell bodies of the trigeminal ganglion are the main source of CGRP. The start of the headache part of a migraine begins with release of these 3 neurochemicals, which then drain out of the brain via the jugular vein, are metabolized in the liver, and released from the body in the toilet. It takes 4 to 72 hours for this process to occur. And this is the reason a migraine may last, as definition, by 4 to 72 hours. It's a process dictated by human metabolism and not some headache committee. How about that? What's the difference between episodic and chronic migraine? Episodic migraine is defined as 14 or less headaches a month, while chronic migraine is 15 or less headaches a month, 8 of which have migraine features. An episode of migraine stands out as an event of headache, nausea, vomiting, sensitivity to light and sound, and the need to be down. Persons with chronic migraine may have these same features every day, or 80 to 90% of the time, so that it seems to the afflicted individual to be just one big headache time, or nearly continuous headache. The time span of headache being 4 to 72 hours may be lost with this kind of migraine, since the headaches are so continuous. Does migraine have different phases? The migraine syndrome has 4 individual phases: prodrome, aura, headache, attack, and postdrome. And the following analysis refers to migraine persons who suffer an untreated migraine. The prodrome phase. This first phase of migraine comes on for hours to a day before the attack. Prodrome symptoms can be mood changes, irritability, excitability, depression, yawning, food craving, and the need to urinate. The aura phase, approximately 30% of persons with migraine have an aura. And the most common aura here are visual changes of seeing zigzag images, black holes, or half of things. Some persons have a spreading numbness or tingling which moves across the arm to the hand and then the same side of the face, lips, or tongue. As the tingling moves up, there's clearing of the involved anatomical location that happened earlier. Tingling in the right little finger may move to the ring finger and then the middle finger, but by the time numbness is to the middle finger, the little finger numbness has cleared. It passes over these digits and all. A smaller number of persons may develop aphasia, which is difficulty in understanding words and speaking. The order of symptoms here is always visual symptoms before numbness, before aphasia. All these RF symptoms by ICHD criteria should clear within 60 minutes. The headache phase. A headache can last 4 to 72 hours and is a headache with true migraine features being one-sided, severe, throbbing, associated with nausea or vomiting, and sensitivity to light and sound. Untreated, the severity of headache is worse on day 1 and better by day 3. One survey of 1,100 migraine patients published in May 2020 in Headache reported that 44% of people said that their migraine headache phase usually lasts up to 24 hours. 33 and a third of patients had headaches lasting longer than 24 hours. And next and last is the postdrome phase. At this time, most persons have little or no headache pain, but they don't feel normal. This feeling may last 24 to 48 hours. During this time, people say that they're not as sharp and feel hungover, while some feel up, elated, hyper, or euphoric. Many postdrome migraine patients report pain on just touching their head, a symptom called allodynia, where touch is perceived as painful. Why do many persons with migraine only have headache for a short time? Early treatment of migraine in 10 or 15 or 20 minutes may come for persons treating quickly and at onset of their migraine with a triptan, especially the quick-acting triptans like subcutaneous 6 milligrams sumatriptan or 5 milligram zolmitriptan nasal spray, which both work in 10 minutes. Intramuscular or nasal spray DHE and eye drop timolol could also be included in the quick onset list of drugs for migraine. The other oral triptans, such as rizatriptan, almotriptan, and elatriptan, take at least 30 minutes to work, and the longer duration triptans, such as naratriptan and frovatriptan, take 1 to 2 hours to kick in. Then there's the issue of when during the phases of migraine a patient treats. I always encourage patients to treat during prodrome if they can accurately define it. It would be treating early before the headache part begins. The 30% of patients who have an aura, which usually starts as a visual aura, should all treat at onset of the aura with a triptan. The other 70% of patients who have migraine without aura and who cannot identify their prodrome should treat their migraine at the onset of the headache itself. In general, acute treatment of migraine with a triptan gives a 2-hour headache-free experience for 70 to 80% of persons, making triptans still the best drugs for treating migraine, treating more quickly and cheaper than even the new drugs for acute therapy. The new acute treatment drugs like Rayvow, Nurtec, ODT, and Ebrevly are all name-brand drugs, so they're more expensive than triptans. Listed product information for the new drug states that Nurtec OTD, quote, provides pain relief in 1 hour, end of quote. Ebrevly provides freedom from headache pain at 2 hours for 20% of patients, and the advertising drug information for Rayvow says it, quote, could provide fast and complete pain relief in 2 hours, end of quote. David Rind, MD, the Chief Medical Officer of ICER, said regarding the use of Nurtec, Rayvow, and Ebrevly, quote, for patients who are unable to take triptans or who don't get adequate benefit from those more affordable options, these new migraine therapies appear to relieve migraine symptoms in 10 to 20% more patients than who respond to placebo, end of quote. The triptans work for more persons and usually faster than the new 2020 migraine drugs. The point of this information regarding treatment is that how all the drugs for acute therapy for migraine work depends on the key question of this article, namely, how long does the migraine last? The bottom line is that adequate, quick migraine treatment and fast treatment of migraine determine how long the migraine will last. What happens to patients with migraine who get a week or 2 or a month or years of daily migraine? They start having migraine that are longer lasting, more frequent headaches, and they develop chronic migraine because they're over-treating with headache drugs. This group of patients is likely making the following mistakes to prolong the duration of the migraine. They're not using a triptan or one of the new 2020 drugs for treatment. They use over-the-counter drugs for treatment like Excedrin, ibuprofen, Tylenol, or naproxen, which provide a little bit of headache or a lot of headache relief for some persons. It depends. The problem is when they keep taking the drugs too often, then they may develop transformation of migraine from episodic to chronic migraine. They may use a drug that provides adequate treatment, but they do not treat at the onset of the migraine. They treat too late, and if they use a triptan, they do not have a 2-hour headache-free experience. Their headaches continue. It's said that treating with triptan any time during a migraine will help some, but it will not provide a 2-hour headache-free experience if the triptan is not taken at onset. Next, I want to talk about what is the migraine timing cycle. It's generally thought that local vasodilatation of intracranial extracerebral blood vessels and a consequent stimulation of surrounding trigeminal sensory nervous pain pathways is a key mechanism underlying the generation of headache pain associated with migraine. This activation of the trigeminal vascular system is thought to cause the release of vasoactive sensory neuropeptides, as I've mentioned, especially CGRP, that increase the pain response. The activated trigeminal nerves convey nociceptive information to central neurons in the brainstem trigeminal sensory nuclei that in turn relay the pain signals to higher centers where headache pain is perceived. It has been hypothesized that these central neurons may become sensitized as a migraine attack progresses. The triptan anti-migraine agents, that is, sumatriptan, rizatriptan, zolmitriptan, ilitriptan, ferotriptan, and naratriptan, are serotonergic agonists that have been shown to act selectively by causing vasoconstriction through 5-HT1B receptors that are expressed in human intracranial arteries and by inhibiting nociceptive transmission through an action at 5-HT1D receptors on peripheral trigeminal sensory nerve terminals in the meninges and central terminals in brainstem sensory nuclei. These three complementary sites of action underline the clinical effectiveness of the agonists, the triptans, against migraine, headache pain, and its associated symptoms. The migraine timing cycle spelled out would be, number 1, trigeminal activation. Let's imagine someone starts a headache at 8 o'clock. That's when trigeminal activation occurs and the cerebral arteries start to vasodilate. In 20 to 40 minutes, that's 8:20 to 8:40, later the neurochemicals CGRP, neurokinin A, and substance B are released by the migraine process from ganglia to inflame the trigeminal nerve into the arteries and later the thalamus. Number 3, at 2 hours, the arteries dilate, so about 10 o'clock, and they're inflamed. Blood pulsing through dilated, inflamed arteries causes pulsatile, pounding headache. Number 4, past 3 hours, the thalamus, also known as the pain center of the brain, is turned on by the migraine process. On my blog, I have a picture of the migraine timing cycle. Migraine is an episodic disorder of headache lasting 4 to 72 hours. After a migraine, within a day or so, the nerve peptides in the brain are metabolized and leave the body in a few days through the liver and the toilet. However, if one overtreats with certain drugs, caffeine, NSAIDs, Tylenol, pseudoephedrine, triptans, hydrocodone, or butalbital drugs, then these painkiller drugs drive the cyclic production of the inflammatory neurochemicals, and the headache keeps on going. At that point, episodic migraine may be transformed into chronic migraine, which is defined as 15 headache days a month, 8 of which meet the criteria for migraine. This occurs because the body doesn't have enough time to eliminate the drugs or the released neuropeptides, and they stay in the brain and activate the system so that 1, 2, 3, 4 of the migraine cycle occurs continuously, resulting in frequent, oftentimes daily headaches. In 1988, the International Classification of Headache, this syndrome was named rebound headache, but now this term has been replaced by medication overuse headache. This is a common headache diagnosis and the problem compromising about 80 to 90 new visits to a headache specialist. The International Classification of Headache states that in general, all migraine patients should limit caffeine, painkillers, and triptans to only 2 days a week. This is the most the body can tolerate and get rid of the drug and the neurochemicals without transforming into frequent headaches. Medication-induced headache relates intimately to how long a migraine headache lasts. Persons who overtreat all have long-lasting migraines at durations longer than the textbook time of 4 to 72 hours. The International Classification of Headache Disorders 3 describes medication-induced headache, the old name rebound headache, as a syndrome related to overtreating headaches with painkillers. Chronic migraine is a term used for a patient who has headache over 15 days a month, 8 of which have migraine features. A significant number of these patients have medication-overuse headache, and this affects about 4 million people yearly. Medication-overuse headache occurs after the painkillers or analgesics are taken frequently for headache. The headache pattern from this overtreatment often results in the occurrence of severe daily disabling headaches. These headaches usually have migraine features also. Medication-overuse headache occurs mainly with migraine patients and rarely with tension-type headaches. There's a common pattern of transformation from rare or episodic migraine to chronic migraine. Many patients fluctuate in and out of medication-induced headache depending on how bad their headaches are and how much medicine they take to treat it. Medication-induced headache is a concerning, disabling, well-known worldwide problem. It's the number one diagnosis for new patients to a headache clinic and affects 1 to 2% of the general population. The problem with medication-induced headache is that patients typically rotate to different drugs and take many drugs at the same time. The causes are worse than the headaches. Medication-induced headache comes from overtreating with painkillers or headache medications, such as simple over-the-counter drugs like caffeine, Tylenol, or Advil, or more complicated drugs like opioid, narcotics, painkillers, barbiturates, or triptans. Next, I'm going to give you a list from the International Classification of Headache Disorders of the drugs that usually cause medication-induced headache, the limits for treatment of that. So triptans, if you take them more than 10 days a month, there's a risk of developing medication-induced headache. For non-opioid analgesic drugs such as caffeine, acetaminophen, ibuprofen, and naproxen, more than 15 days a month of treatment can do it. And then for butalbital or opioid narcotics taken more than 10 days a month can do this, give medication-induced headache, then the headaches last a long time. The bottom line from this talk regarding the duration of a migraine headache is that it's usually 4 to 72 hours, unless the migraine victim is overtreating with headache medication. Thanks very much for listening to this. Please click on subscribe down there and like, and I'll see you guys on the next talk.